get straight into our first topic. Should smoking be banned on hospital grounds and hospital premises? Get your calls in right now. All NHS sites covered by the University Hospitals Dorset Trust will be smoke-free following the introduction of a ban on tobacco products. The Trust said the decision would create a healthier environment for patients, visitors and staff, with tobacco being the leading cause of preventable deaths. They say it wasn't an easy decision to come to because they recognise that smoking isn't a lifestyle choice or bad habit, but instead a really powerful addiction. We have some numbers of the impact of smoking on the NHS that we can show you right here. So on hospital grounds, 1 in 4 hospital patients smoke. That's quite a huge proportion, isn't it? That's a quarter. Smoking accounts for 64,000 preventable deaths every year. And I must say, on my way here to the studios this morning, I passed University College Hospital in London. And do you remember they spent £70,000 on a giant shiny pebble that is outside the doors of the hospital? So you pass it as you drive through Gower Street, and on it is always a whole lot of people perched smoking away. Yeah. Some of them on drips. Some of them seem to have those little oxygen things in their nostrils, still smoking away. Almost every minute, somebody's admitted to hospital in England with a smoking-related disease. So let's start with you, Cherry. I mean, should smoking be banned anywhere near hospitals?
Sorry, but unequivocally, yes. So I was in Charing Cross Hospital with a kidney infection many years ago. And just when I started to recover, you feel like a bit of a mole coming out of a hole. You're bleary-eyed. You just desperately need some fresh air. And so I went out to the front of the hospital, absolute sea of smokers. I wasn't well enough to be able to go for a walk in the park, but I desperately needed to have daylight and just to go outside. There was nowhere that I could go where I wasn't in a cloud of smoke. It's depressing. It's not somewhere. It's that it creates it's a habit that affects other people, and that's a problem. I do understand that it's a way to relieve stress for people, but it directly affects other people, and it's a place to heal. It's a place of health. So should you be allowed to smoke around people who are trying to get well? I don't think you should.
Well, let's bring James into this. We've just said smoking is a powerful addiction, not a lifestyle choice. Most people doing it wish they weren't doing it. It's really expensive and they know that it's not good for them and maybe is responsible for their stay in hospital. But how difficult is it if you're A, ill enough to be in hospital, B, addicted to smoking and nicotine, and C, you're told, well, you can't smoke anywhere on hospital grounds at all? What's meant to happen then?
Well, I think this is the issue, and I think the issue that you raised is absolutely right. There's nothing worse than going into a hospital and at the front doors you're just entering or leaving just a haze of fumes and all that sort of thing. And as somebody who has smoked and at one stage in my life thought it was fabulous, I now don't.
I did too, by the way, just to put my hands up, very much so.
So been to that movie and I totally understand that. If you're saying to somebody who's in hospital, you're now going to be enforced to give up at this point in time, I think the simple answer is you don't have to make a place smoke-free, but you do have to separate smoking and non-smoking. So by front doors, by entrances, by back doors, by service spaces, having to walk through it. Get rid of all of that. There is plenty of space that you could have somewhere where smokers can go, because I think it's impractical to ban it. Do I want to see people stop smoking? Of course I do. Do I want to see, all the problems associated with smoking and all these other things go? Of course. But I think there are ways and means to manage it better. And if they said we're going to manage it better so that people who want to be smoke-free can be, and that there are places that they can go, that they don't have to be encountered by a whole haze of it, great. Yeah. But I think that this ban doesn't help.
The only problem is that because that's a grey area, it's like, well, we can smoke, but you can't smoke. You can kind of smoke there. The problem is then people will smoke and they will spill out into the non-smoking areas. And the staff are so busy in those, and it's already understaffed.
But let's include the staff who smoke. What are they meant to do?
Well, exactly.
But you're allowed to smoke. You're allowed to smoke vapes, which most people do now, instead of really, and hardly not that many people smoke cigarettes. Lots of people vape as well.
Well, as I drove past this morning, one of London's biggest teaching hospitals, this £70,000 polished pebble, and people absolutely puffing, and I could literally say their guts out, coughing and puffing and coughing. And I was stuck by a traffic light, so I really did have a good chance to have a good look at it.
And that's why the separation is so important. And I think that there must be a better solution rather than just banning. As soon as you ban something, then you just send the problem elsewhere.
Then who's going to police that? That's the problem. You're putting extra stress on the staff.
Let's bring Wendy in. She's on the line from Carmarthenshire. Hello, Wendy. Thanks for calling. What do you think of hospitals as completely smoking-free zones?
Good morning, Vanessa.
Morning.
And
Hi.
in Wales, in Carmarthenshire, we have a smoking ban already around hospitals, on hospitals' property and local government property. You're not supposed to smoke in any car park, nothing at all. So it's no different for us. I understand people who smoke. I've got a chocolate addiction, so it works both ways, really, doesn't it? But
can definitely relate to that one. But Wendy, so in practice, what does happen? What happens to the people who can't possibly give up just because they're in hospital, because they work in a government office? They have to keep smoking. Where do they go and how does it work?
Well, if they if they work in a local government office and they smoke, you get dismissal, or you get the warning. The same it is in a hospital.
Yeah.
So, but if you're really ill in a hospital, you don't want a cigarette anyway. I understand the nurses, they are very stressed, and I would never go against one of them smoking. If they want to do it, it's up to them. But vaping, people do a lot of vaping, which I've read that it's worse than a smoking, to be honest with you, because it's supposed to cause popcorn lung.
Well, I don't think so. I think we think that the possible kind of side effects long term of vaping aren't well known yet, but the sort of cancerous effects are either not there at all or much less, aren't they? Doctors would prefer to see you vape than smoke, wouldn't they?
Yes, I mean vaping isn't ideal, but it's significantly less risk than smoking, which is the worst.
Yes, Wendy, thanks very much indeed for the call. I mean, I wonder whether it would seem to be a bit draconian, this, Cherry, when people are ill. When
I think it's draconian.
You're at your weakest.
I understand, but I think it's draconian. See, my father went in hospital and he smoked, but while he was in hospital, he did not smoke because you weren't allowed to smoke. So for a period of time, his body got a rest. I think it's draconian to not have this in place. This is the way the world is going. Be like serving alcohol as part of a meal, like a hospital meal. It's a place of healing, and those should be the parameters.
They should be the parameters, but if you just go for that, then what do? Then you end up with the boundary of the hospital becoming the smoking area. So what I'd rather see places which they should be further away or filtered away so that the air doesn't contaminate. Because I agree with you, I don't want to have to walk through that. I don't think anybody does. And if you're ill, that's the last thing you want. Having said that, if you don't have a place for staff to go, if you don't have a place for people to go, they'll just go to the boundary of that hospital, and then that's become and it might be a main road, it might be something else.
Do you remember when they said there should be no smoking in pubs, and everyone was like, oh my gosh, this is crazy, no one will like this. And actually now people don't smoke because it's inconvenient. Like the effect it has is people go, well, I have to go all that way, I might not bother. That's surely a good thing for a hospital, for their patients to not be chain smoking while they're trying to get better. But because it is a pain having to go.
The culture, though, of people leaving wherever they are to go outside and smoke, and those who don't go are completely excluded. So those who don't smoke, sometimes, if you remember Jennifer Aniston in Friends, going along at work to the smoking kind of, fire escape, because otherwise she'd be left out of every conversation and everything. But, you're at a wedding or something, and there's this empty table, that empty table, and everyone's outside puffing away. I mean, it's kind of
But it's becoming less and less because it's incredibly expensive, it's really antisocial, and it's a total faff. And we should make it as much of a faff as possible.
I'm all up for making it a faff.
Make it a faff is my slogan.
But I think that a simple ban doesn't achieve, and it just makes it worse.
But it did in pubs. It did exactly that.
because they went into the pub garden.
Yeah, I mean, the pubs,
or they stand outside the door.
You're not allowed even outside the door, not even in what used to be the fresh air until you stood there and smoked in it. Let's talk to Sarah in Wiltshire. Hi, Sarah.
Hi, Vanessa.
Hello. Is it a good idea to ban smoking on hospital premises, outside, in the grounds, in the car park, everywhere?
Right. I am a smoker, but you have to have respect for people that don't smoke. So when I've been in hospital with my son, remove yourself far away to the proper smoking area. And just have respect for the people that don't smoke.
But imagine if there was no smoking area at all, and you'd have to either walk a heck of a long way or get in your car and drive off to somewhere else just to have a cigarette. What then?
Vanessa, I've been on a 10-hour flight to Mexico.
How was it?
I can go without, I can go without a cigarette.
Explain how you felt when you got off the plane after the 10-hour flight, Sarah.
I waited for 2 hours for my suitcases.
Without smoking, obviously.
Yes.
And how was it? I mean, was it doable? Was it so doable that you thought, gosh, why do I carry on smoking? Or was it so agonising you just couldn't wait, you were gasping?
No, not at all. Absolutely fine. I can wait.
So do you think, so if you can wait so comfortably, do you just not think, well, why don't I just give up or try to?
I tried lots of times. I gave up for 11 years, but then I had a big grief in my life. I lost a partner.
Oh, I'm sorry.
And then I started again. So, no, it's fine. But I agree that somebody that's going into a hospital should not have to smell someone's smoke.
Good call, Sarah. Thank you very much indeed. Let's talk to John in Staffordshire about this. John, do you think that they should ban smoking everywhere in connection with the hospital, all the grounds and everything too?
No, it's absolutely ridiculous, I'm afraid.
Why do you say that?
I got misdiagnosed for 3 years about stomach pains, ended up for 3 months in hospital after catching sepsis in there. And the amount of people that I saw smoking outside, I'm a smoker myself. I'm a pub landlord. I don't allow vaping in the pub because in 10 years' time that's going to come out, but that's a separate issue. The amount of revenue, all the figures you brought up before, the amount of revenue that smoking brings into this country and then gets funneled to the NHS, I'm really sorry, but that is just mental.
So you're saying that because smoking raises money for the Exchequer and also for the tobacco industries, it shouldn't be banned in hospitals because hospitals are getting financed by the Exchequer and therefore it makes logical sense that everybody should be able to smoke because hospitals profit from... I mean, we've got our businessman here is James Max. Is that a business model for you?
It's a business model of funding that I think when people say that smoking costs the NHS a huge amount of money, I think first of all, those people will live less amount of time. So therefore, they'll probably cost the NHS less over a period of time because they've died. And secondly, as John correctly says, the amount of revenue that comes in from tobacco and smoking related products. But I think if you conflate the argument too much, arguably, it's the government's job to help and protect the safety of individuals. And therefore, I would support helping people to stop smoking, but also making sure that the choices that people have so that they're encouraged rather than, outright bans. Because the problem with outright bans is that they normally cause an unintended consequence. And the unintended consequence in this instance would be that people would just move further away from the hospital, probably onto a main road. It's probably not very sensible. That's probably not safe for people either. So I think the objective is get people healthier and stop people having to smell smoke if they don't want to and imposing on them, but also make sure that people are safe and then encouraged to stop.
All right, thanks so much.